Another question from one of our readers: what is the status of mini med plans? Is there a short-term outlook pre-2014 and maybe a longer-term outlook beyond 2014 mini med plans?
There were some clarifications issued, and mini meds or limited medical plans are prevalent in certain sectors of industry, and typically those plans have a very limited annual maximum benefit that's payable. And as you think back to what we've talked about this morning relative to healthcare reform, that's going to become problematic and still be in compliance with the regulations. And so the agencies recognize that there may need to be a transition period for those limited medical policies. So what they've issued is what I would deem to be a 3-year ramp-up period, where those limited medical policies in 2010 can have a $750,000 annual maximum. It goes up in 2011 to $1.25 million, in 2012 to $2 million, and then in 2014 it can have no limit. Now, the other piece that's going to require a lot of clarification to answer this question is one of the statements that was made in the clarification was there may be an opportunity, and every word in these regulations is important. One little word can completely change the dynamic of what it means. So there may be an opportunity if access is significantly impacted or premiums are significantly impacted in order to comply with healthcare reform, there may be an opportunity to apply for waiver from the provisions of healthcare reform. Now, there are a lot of companies that offer mini-meds, and some of them have jumped on that as a statement of fact, so you have to be very careful. We don't have the clarifications. We don't know what the waiver would look like, what the criteria is going to be in order to qualify for that. So those clarifications don't exist today. This is a landscape that's yet to be seen in terms of what it will mean long term.
I have a question about auto enrollment, and they even indicated slide 12 for us. Does this cover just new hires, or does it also cover open enrollment and all employers? Or employees, excuse me.
As we discussed earlier, if you're in that 200 and above employee range, then you're going to be required to auto-enroll your existing employees starting in 2012 and new hires. And so your enrollment process is going to need to change at that time. There are some exceptions for folks who have collective bargaining agreements. You basically, the provisions don't kick in until the expiration of your collective bargaining agreement. So depending on how far out that goes, you might be exempt from that, but otherwise you're going to fall under it.
And I think we're waiting. This is one that we want to see the clarifications on definitely. And the effective date is a little tenuous in terms of what the clarifications, what the actual regulations say. It may move that effective date up a little bit, but it may not impact you a lot, because don't you today capture some type of an affirmative or negative response from every single eligible employee? Do you already do that today, right? I see a lot of heads nodding. So it may just adjust your timetable of how you do that to be in compliance. We don't know yet, because we need those clarifications. So it may not, hopefully, have a lot of impact in your process. It's just a matter of making sure you continue to capture some type of response. Because if you offer multiple options, what we don't know is if you don't get a response, you have to automatically enroll that person. Is it the lowest cost option? What direction do you take? So definitely some clarifications are going to be needed.
And all of this is moving toward, on January 1, 2014, having as many people covered either through their employer or through an exchange or through some other means as possible. And so that's kind of what they're shooting for.
We do not hold an open enrollment except for this year for dependents. Are we required to start offering an open enrollment?
No. Not on a broad basis, but you are required in this first cycle, because of the dependent age change and the removal of lifetime limits, you do have to have an open enrollment. It's very defined that you have to have a 30-day window. So if you're a January 1st renewal, you have to have communication out to your employees, and at the employee level that satisfies the requirement regarding the change in dependent age and regarding the removal of lifetime limits from the policy. If you miss that 30-day window on the front end, the language does say that you have to give a 30-day window on the back side of your renewal, with coverage then being retroactive to your policy date. So if you're not currently doing open enrollment, you do need to make sure that happens for this particular renewal cycle coming up for those two issues. I've not seen anything else that mandates, in a broad stroke way, open enrollment every year going forward.
I'll piece together this question. Cadillac plan encompasses HSA, HRA, et cetera, as well as insurance policy. Does that?
I thought that it excluded standalone vision and dental.
I think that's true.
So that's as far as the Cadillac plan goes.
Yeah, so on the Cadillac plan, they'll look and see what was the dollar amount of premiums paid, and I believe, and I don't know if we have that in our notes here, or may not, but I believe that it covers, I do believe it covers medical plan, FSA, HSA, but it does not include standalone dental and vision. Is that what you remember?
That's my recollection, and I think HRAs may be excluded from that.
Mm-hmm.
Okay.
And again, this is one of those provisions that doesn't come into effect until 2018, and so the regulators are kind of approaching their regulation writing on the same schedule as the effective date, so they haven't really done anything on the Cadillac plans as yet.
Should a group try to remain grandfathered or just move forward to being non-grandfathered?
That is a very group-specific discussion, because without knowing the person that asked the question, their specific landscape at their employer group, what your benefits are, what your premiums are, when your anniversary is, what your budget was for your renewal cycle, those are all the items that come into play in trying to really answer that question in an absolute yes or no fashion. So I'd say you need to get advice from your, broker and consultant, your tax accountant, your attorney. I mean, it's a process to go through, but I go back to what I said a little bit earlier. Go through your renewal process. Look at what you're faced with. Look at what you need to do to keep that plan viable going forward. Make those decisions. Then bounce that back to healthcare reform. For example, for our clients, we actually have a calculator that we can plug in your current benefits and all those provisions. We can plug in what you're thinking about doing in terms of renewal, and it will go through all the formulas that are in the law, and it will tell us whether you've triggered loss of grandfather status. That happens, then we go back to the provisions and talk through what now are you going to be subject to, and are any of those going to be a difficult challenge for you to comply with. So it really changes the navigation process that you go through at renewal. So that's a long-winded way to say I can't say yes or no to that question.
And one thing Karen has pointed out is that in order to maintain your grandfather status, someone is going to have to be tasked with keeping good records of what you had on March 23rd and what you have going forward, and that's kind of one of the intangible costs that might factor into your cost-benefit analysis of is it really worth it to try to keep that grandfathered status.
Absolutely.